I'm Stacy. So we're going to go over the hair and scalp disorders, nail disorders. Okay, so I would know this. It's kind of annoying, but just learn it. So the hair growth cycle consists of 4 phases: antigen, catagen, telogen, and exogen. So antigen is the growing phase. Or anagen is the growing phase. That's like probably one of the more important ones to remember. Catagen, it regresses, telogen rests, and exogen sheds. So a way to remember this is a growing cat regrets to rest, especially when shedding, to try to remember this. So A, growing, and anagen growing, cat regresses. 2, telogen resting, especially exogen when shedding. Because they could ask you literally like, when is growing cycle? What is the resting cycle called? Something like that. So non-silicerial, non-scarring hair loss is going to be male or female pattern hair loss. So androgenic alopecia due to genetics or increased DHT. So we have terminal hairs transformed into vellus hair. Symptoms in men is going to be a receding hairline or gradual appearance of hair from the ground and frontal scalp. Females is going to be just a thinning. So treatment's going to be minoxidil, finasteride, or spironolactone, or a hair transplant. So here's some examples of effluvium. So let's look back at this. So knowing these cycles are important. So sometimes are we regressing? Are we in the catagen phase? Are we in the telogen phase or exogen phase? Like maybe a patient is just like in the exogen phase and they're shedding their hair, but they're not actually losing hair, for example. So telogen effluvium or anagen effluvium. So telogen, stress is causing the hair roots to be prematurely put into that resting phase, or anagen is like due to chemotherapeutics. So it bypasses the telogen phase and it comes out in the growing phase. It can be due to meds, like we said, chemo, childbirth stress, thyroid issues, and it's a temporary loss of number of hairs. So the scalp looks thinner. Top are the telogen, bottom anagen. Alopecia areata is going to be autoimmune and due to T cells and genetics. It's going to have these like exclamation point hairs, inflammation, nail pitting, brittle nails, ankylosis, and the hair falls out in like little small patches. So as you can see right here, it's kind of like upside down, but we have this short little hair and then right like a dot. So it's almost like upside down exclamation point or like an eye. Treatments can be topical corticosteroids, minoxidil, puvellite, and laser. And I think that's probably pretty important to remember. Pressure alopecia is going to be trauma inciting event. It regrows. Trichotillomania is going to be one of our psych disorders, and it has these like different hair lengths, incomplete, distorted follicular anatomy hallmark. So make sure that you know this. So it's a person pulling out their own hair. So you can see like we've got these like long points and then we have these shorts. It's not going to look like our alopecia areata because we're not going to have like nail pitting or brittle nails, and we're not going to have like little patches like this that fall out with these little exclamation points. Alopecia totalis universalis is going to be complete hair loss on a scalp, and they have these like shiny shins and hair loss. And you can see here's like a model who has this. And so here's totalis and here's universalis. Cicatricialis, tricial. Okay. anyway, scarring alopecia is going to be this alopecia with this permanent hair loss on crown and vertex expanding with inflammatory signs, and it's due to traction or stress. So, or like harsh relaxers or dyes. So sometimes like, constant braiding or like weaves sometimes can cause this because of constant traction. Another form would be like constant use of hair extensions or like perms or these relaxers or like box hair dyes from the store, not from a beauty shop, can cause this. So it's important, of course, like to make sure that there's not too much stress on your hair, or it can cause this and it's not going to come back. Lichen planopilaris is going to be red, inflamed skin, patchy, progressive to permanent hair loss. Chronic cutaneous lupus, discoid lupus, we had talked about that already. They've got the scarring alopecia with a rash of painful symptoms. Acne keloidis is follicular keloidis is going to be like acne with hair loss, and they've got these like kelo scars. Sounds just like the name. Again, here's like another traction alopecia because of that mechanical traction, type braids, ponytails, etc. Hair excess, hirsutism, is going to be because of an increased androgens or increased in organ response or a sensitivity to androgens. So you're going to see elevated testosterone, and you're going to have that male pattern hair growth that's going to be dark and coarse in women, face, chest, abdomen, back. It's seen in Cushing syndrome, PCOS, drug reactions, and then ovarian tumors as well. So here's some like notes about hirsutism in women. They have really high testosterone, low LH, and normal DHEA. And it's the most common in postmenopausal women. However, in different types of hirsutisms, the DHEA may be elevated. Hypertrichosis is werewolf syndrome, and it has this hair growth that can be small patches or diffuse, as shown in the picture. Trichomegaly is what all women want, where they have these like long eyelashes or eyebrows. It can be caused by genetics, fetal alcohol syndrome, HIV, hypothyroidism, porphyria, or malnutrition. Nail disorders. So paronychia is going to be this terrible infection near the nail, bacterial or fungal, at the confluence of the nail and the skin. So basically you have to get the pus out to treat it. Clubbing. So we've all done this in like EPC, but you take your two nails together. If you can see a little triangle, then you don't have clubbing. If you can't do that, then you do. And that is our Schmalmach's sign. We have this like disappearance of a window. It is not specific to COPD, because apparently that gets asked. And here's all these other causes. Koilonychia is going to be that spoon-shaped nail, concave nail. I would just know that that's what that's called. It can be associated with Plummer-Vinson syndrome, so that dysphagia, iron deficiency, and esophageal webs with koilonychia. Know that koilonychia and iron deficiency are associated. Digital mixoid cyst. So you have this cyst and it creates this like nail that's not going to grow properly, and you don't have a groove along the nail. So, and if you open this up, you'll have like sticky straw, blood colored fluid. Nail dystrophy. So it's like these little parallel lines, depressions, due to like picking at the fold margin, and it creates this disformity. Buhl lines are going to be deep groove lines, depressions running side to side because of like injury or like some sort of deficiency, like you hit your nail or something. So here are these lines that are growing out, and these are me lines, and they arise and they're due to like Hodgkin's disease, arsenic poisoning, chemotherapy, carbon monoxide poisoning, and leprosy. And we had seen these previously in slides due to arsenic poisoning, Me's lines. So here's Buhl's lines. It's like more wavy, and here's Me's lines. I always thought this picture was like gross. But anyways, onchyomedesis is a shedding of the nail beginning at the proximal end, and it progresses to the free edge. So it's like sheds backwards. Anyways, make sure that you know that word, what it means. Oncholysis is going to be a lifting of the nail as it separates from the distal end and it becomes loose. That just, I'm sure it's not painful, but it just sort of hurts me inside. Pitting nails associated with psoriasis, Reiter syndrome, sarcoid, alopecia areata, or atopic dermatitis. I would know psoriasis associated with pitting nails. Brittle nails are associated because of washing, drying, exposure to things, too much nail polish remover, cleaner, so on and so forth. Trichotillomania is going to be associated with lichen planus, psoriasis, alopecia areata. It has that longitudinal ridging, sandpaper rough nails. Onchocytia or onchocystitis is going to be that peeling of the end, lamination in 2+ layers, and scaling away in thin flakes. Onchorexis is going to be associated with a brittleness, breakage of the nail, and these vertical ridges. It's associated with hyperthyroidism and anemia, as well as other diseases. Onychomycosis is that, or in other words, like tinea inguinum, so fungal infection of the nail. It's that white, yellow thickening and separation. Treatment is going to be grisofulvin, turbinafide, itraconazole, ketoconazole. Remember, like some of these affect the liver, or they may have to have the nail removed. Leukonychia, so a white punctated dot in the nail, is due to an injury, and it grows out. Okay, and then here's the striated form. Total is because it's hereditary. Lindsay's nails are going to be the half and half nails. Half is white, half is not. So the tips of the nails are going to be dark, and the more proximal part is white. So the lunula is going to extend to half of the nail, and it's associated with renal disease. So make sure that you know that the bottom part is white, associated with renal disease, Lindsay's nails. Terry's nails, the bottom's white, top is dark, just like Lindsay's nails. So it's got this ground glass nails, and distal nail is pink, reddish brown. And this is due to like liver cirrhosis, type 2 diabetes, CHF. And so if the lunula is destroyed, so you can see like it sort of extends further. So it's not half and half like Lindsay's. It's like more like mostly white, just the tips are darker. Munirki's nails are going to be due to hypoalbuminemia, and it has this paired lines that don't move with growth, and they're going to be stationary. So if this isn't growing, know that it can be associated with hypoalbumin levels. Splinter hemorrhages, we go back to bacterial endocarditis, to our cardiology lectures. It's these like thin brown lines. So it's basically like blood under the nail. So know that that's associated with bacterial endocarditis. I think that's one of the more important ones for like boards. Longitudinal signs. So this is like this part I think is like scary. So melanonychia is going to be associated with melanoma. It can also be infection and trauma, but you have to rule out melanoma. It's this like pigmented stripe that runs all the way down the nail. Subungual melanoma. So it gives this like Hutchinson sign. Again, that's what this like stripe is. And they have to, from my understanding, they have to take off the whole finger, like at that joint, to get rid of the melanoma. Subungual hematoma is going to be blood under the nail. Red lunula is going to be a red color, and it's usually a more of a heart diagnosis. Azure lunula, it's hard for me to say, is due to Wilson's disease. So remember, it's that like copper deposition, or it's due to silver, and it has that blue discoloration of the nail. So here's Wilson's again, and they've got this Kaiser-Fleischer rings. They've got the neurological disease and liver disease. Yellow nails is usually like fungal infections. Could be due to like nail polish stain. So if the yellow is like growing away, then you know it's nail polish. Thyroid, lung disease, diabetes, psoriasis, pulmonary symptoms, lower limb lymphedema, chronic sinusitis. Defective metabolism. So we have alopecia or sparse thin hair, seborrheic dermatitis. Vitamin C, ascorbic acid, is associated with scurvy. So hemorrhagic perifollicular corkscrew hairs, woody edema is noted. And so here's like vitamin C, and knowing that it facilitates iron absorption, and it's necessary for hydroxylation of proline and lysine and collagen synthesis, and necessary for dopamine and beta hydroxylase, which converts dopamine to norepi. Just remembering that. Copper deficiency is that kinky hair syndrome, or Menkes, and it has that twisted hair, pili-tori, and so it like causes the hair to break off easily. So I would know the difference between like copper, kinky hair syndrome versus our vitamin C. Selenium has these whitened nail buds, cirrhosis, and sparse light colored hair. There's biliary atresia associated with this. They have hair loss, light hair, dryness, scaly skin, and weeping lesions. Oh, I'm sorry. This is essential fatty acid disease, have these. Okay, so just know like the selenium has the whitened nail buds. The essential fatty acid disease is what has the like lighter hair, hair loss, and so on and so forth. All right. So the next one will be about benign neoplasms, but I'm going to stop here.